Hi there, today we're talking about some major changes coming to Medicare in 2026. Now some of these we've already covered in recent videos, however there are some additional and very large changes that we will be discussing in today's video. Now these changes could have major impacts on your premiums, your deductibles, co-pays for drug prices, and even your Social Security check. So make sure you stay tuned to the end of the video. If you're already retired and taking Medicare, or if you're about to turn 65, this is absolutely information that you cannot miss. So let's start with a basic example. Meet Rebecca. Rebecca is an average client of ours who's 67 and currently enrolled on Medicare. Now, like many, her budget was tight, but it worked. She expected a Social Security cost of living to help with rising prices. Then she opened her Medicare Part B premium and noticed that her bill had jumped to over $200 a month. This pretty much completely wiped out her Social Security cost of living adjustment. This is exactly the type of surprise we're hoping to help you avoid. 2026 is a landmark year for Medicare, and there are a few key reasons as to why. The Inflation Reduction Act is changing everything. This law allows Medicare to negotiate drug prices, caps insulin costs, and brings long-term savings to the program. But there's a catch. These savings are coming from somewhere, and it's coming from the insurance carriers and the drug makers. They're raising their bids for Part D plans, and that means you could see higher premiums for prescription drug coverage. Plus, as more care shifts from hospital stays to outpatient visits, the cost burden moves to Medicare Part B, and that means higher premiums for beneficiaries. So let's talk numbers. Specifically, I want to start with Medicare Part B. In 2025, the standard base beneficiary premium for Medicare Part B was $185. Now, although those numbers haven't been released for 2026, it is expected that it will be approximately $206.50. Again, that is the base beneficiary premium, so it could be more than that. That's a jump of 11%. For the average retiree, that's an extra $258 per year. For couples, it could mean more than $500 a year in extra costs. This is expected to eat up almost the entire Social Security COLA, especially for lower income seniors. And it doesn't stop there. Deductibles are on the rise as well. In 2025, the deductible for Part B was $257. And again, although these numbers haven't been released, it's expected that in 2026, it'll probably be somewhere between $270 to $280. Now, perhaps this isn't as significant as the projected premium rate increase, but it is important to note that whether you have original Medicare alone or with a Plan G or Plan N, then you would still need to meet that deductible before your insurance begins to contribute to the cost share. Now let's move on to Part D. Part D are, as you know, your prescription drug plans, because remember, original Medicare doesn't really cover prescription drugs except for some very limited exceptions. Things like vaccinations, certain oral anti-cancer drugs, chemotherapy when administered in a doctor's office, etc. Now, in the past, it used to be that there was a period of a coverage gap, also known as the donut hole, and then catastrophic coverage. With the Inflation Reduction Act, that's really been eliminated, and now you move directly from your initial coverage period to an out-of-pocket maximum. So once you reach that threshold, your insurance carrier would pay the bills for the remainder of those covered in-network drugs on your plan's formulary for the remainder of the calendar year. Honestly, this is huge for those that had some of those specialty medications that could cost thousands of dollars per year. So in 2025, that financial threshold or cap was $2,000. In 2026, it'll be $2,100. Also, the deductible is of course increasing as well, from $590 in 2025 to $615 in 2026. But here's the real problem. The government subsidy that helps offset premiums is being reduced by about 40%. So even though there is that cap, your monthly premiums will likely still rise, probably by about $10 to $15 per month. Now, a brief pause here. Some of these numbers are just projections. However, as soon as we have the actual hard numbers, especially for original Medicare, Part A and Part B, we will make sure to release a video. So make sure you subscribe to stay up to date. And of course, please make sure to like this video so we can get this information out there. Now, if you have any questions whatsoever, you can reach us in the comments below or at the number on the screen. At iHealthBrokers, we are licensed health insurance brokers. We're licensed nationwide, and there's absolutely no charge for our services. All right, let's get back to it. Now, you've heard me mention a few times in this video the base beneficiary premium, and that is because for Part B and Part D, you may actually have a higher monthly premium based on your income. And this is known as IRMAA, the Income-Related Monthly Adjustment Amount. So if you are a higher earner, pay close attention because those IRMAA brackets are about to go up as well. Now in 2026, the IRMAA thresholds are still based on your 2024 income. If your individual income is below about $109,000 or your joint income is under $218,000, you'll pay the standard Part B monthly premium, which is projected to be $206.50. But if your income is above that, you could expect to pay possibly hundreds of dollars more per month. Now the good news is you can appeal these charges using Form SSA-44. This is basically to appeal that extra IRMAA if you've had certain qualifying life events. This could be things like changes in your income, your retirement, divorce, death of a spouse, etc. So we highly advise that you keep track of this because this could really be an opportunity for significant savings or at least a way to pay the appropriate amount for your Medicare coverage. Now, it's very important that you take advantage of the AEP, which is the annual enrollment period. This is every year from October 15th to December 7th. And honestly, it affects you probably regardless of what type of coverage you have. This is an opportunity for those who are enrolled in Medicare Advantage plans to renew their enrollment or to switch plans. But if you have chosen to stay with original Medicare, perhaps with a Medicare supplement plan, you're going to need a Part D plan for your prescription drugs. This is also your opportunity during the annual enrollment period to, again, re-enroll or change your Part D plans. Medicare Advantage has long been a source of controversy, and we expect that will continue in the years to come. Now, the government is increasing payments to Medicare Advantage insurers by about 5%. That can mean better benefits, but only if you review and compare. But here's the downside. Once you are enrolled in a Medicare Advantage plan, it can be very tricky to switch back to original Medicare with a Medicare supplement plan. That's the key there. Although Medicare supplement plans enrollment is year-round, you are really only guaranteed to issue your Medicare supplement plan if you enroll in the first 6 months after you turn 65 and enroll in Medicare Part B. If you enroll outside of that window, then you may be subject to medical underwriting, which means you could be denied or charged more at the very least. Now, these rules don't apply in all states. However, there are usually some type of regulation surrounding Medigap or Medicare supplement plan enrollment. So this is very important to note. Don't just arbitrarily make the switch to Medicare Advantage just because it seems better for the time being. Remember, later down the line, when you really need a Medicare supplement plan for that increased flexibility, then you may not be able to switch as easily. Okay, so let's just do a brief recap. In 2026, we expect Part B premiums to raise to $206.50 per month, at minimum. The Part B deductible we expect to see between $270 to $280. The Part D cap will be $2,100 and the deductible will be $615. Additionally, there'll be changes to those IRMAA surcharges, and those could possibly be hundreds of dollars more per month. So what can you do? Well, proactively make sure to review your 2024 tax return to be able to better predict those IRMAA charges. Also, prepare in advance for that AEP for Part D plans or Medicare Advantage plans if you so choose, and make an appointment with a broker in advance. Now, in today's video, we really just touched very lightly upon Medicare Advantage versus Medicare supplement plans. However, they really are entirely different. And if you'd like to learn more, I highly recommend you check out this video over here. If you want to learn more about Medicare in general, make sure to check out our All About Medicare playlist. Of course, if you have questions, you can reach us at the number on the screen or in the comments below. We are licensed health insurance brokers. We're licensed nationwide, and there's absolutely no charge for our services. And please, 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 before you go, make sure to like and subscribe. We'll see you next time.